Hello guys, welcome to A2PE Sports Psychology Screencast. We're looking today at stress. Okay, so key focus then within stress, we'll be looking, we need to know a definition of what it is, we need to know causes of it, and then we need to have a look at how elite athletes manage stress. Okay, so definition you can see here, psychological state produced by perceived physiological and psychological forces acted upon your sense of well-being. So it's quite an easy definition. I know it's quite wordy, but basically said it's a psychological state produced by perceived physiological and psychological forces acted upon our well-being. So I think, although it looks wordy, you have got a repetition of the same word twice and also another similar word alongside that. So looking on there, causes of people becoming stressed, you have competition, so when people are in a competitive situation, that can cause stress, finals, first kind of, performance for a first team, for example. Conflict, okay, so conflict can bring on stress, frustration in your own performance, or it could be the referee's performance. Injury can be a massive contributor to stress, worrying about being able to take part again. Evaluation, sometimes of your own performance, can lead to stress. Now, particularly what we need to look at now is how elite performers, like I said, manage stress. So what we're going to do is we're going to split that up into cognitive and somatic. Now, if you remember from last year, we talked about these symptoms that could be cognitive or somatic. We looked at it in the catastrophe theory of arousal stroke anxiety, if you remember. So cognitive, somatic collide at high levels. This led to a catastrophic decrease in performance. So again, we're looking at these terms and saying that people need to kind of manage stress both in the brain and in the body, psychologically, physiologically. So we'll have a look at those things. Now you need to make a quick note on the kind of description of each of them, and then we need to make sure you can use those questions in your corner notes. Cognitive stress management strategies. First one's on positive self-talk. So the definition, as you've got there, positive internal statements that endorse the effectiveness of your performance. So positive self-talk can also be termed as positive thinking. Okay, so it's both positive thinking and positive self-talk. So what kind of things are this? I can do it. We can do it. Things you say to yourself to try and really, or it might be, a football player going to take a penalty kick and they're going there and they might just say, head down. It's something, it's a positive internal statement that can help your performance, and it's just a key word. I mean, it could be when you're running on a treadmill, okay, you might say to yourself, keep going. These type of positive internal statements that can endorse the effectiveness of your performance. Negative thought stopping them, it's a pretty simple concept. It's basically referring to kind of replacing any negative thoughts with positive ones. Can be easier said than done, but it might be someone going to take a penalty, free throw in basketball, and rather than thinking about missing, they're thinking about all the times they have scored in the past. Now, rational thinking then is about when you are feeling under a stressful situation or a negative association with stress, you manage to evaluate the situation logically, okay, which will then allow you to reduce anxiety. So it's kind of, you might be in a really kind of stressful, again, if you use the example of a penalty in football, you might just go into your brain logically and think, ultimately you're taking a shot from 12 yards into a goal, and you should be able to score that in a logical situation. So this can help. It's not like you're not really thinking about all the crowd there. You're just thinking logically. It's 12 yards. It's the same as training. It's the same as every penalty kick I've took before. Just because there's a crowd there doesn't mean it's going to be less successful. Mental rehearsal then. This basically mental rehearsal. We probably touched on this throughout the kind of 2 years. It's basically, rather than physically practicing a skill, it's the process of mentally practicing, of running through the skill in your head successfully before physically performing it. And I think the best way to remember this is from within. So it's that visual that you're running through, you taking a penalty and scoring, a conversion, a free throw in basketball, a penalty corner in hockey. You're running through that process in your head before you physically perform it. And if it's successful, obviously that gives you much more chance of being successful in that skill. So external imagery then, the way I like to think is this is when you create pictures of yourself performing a skill. I think it's a good one to say. I mean, I hate to say the word, but you know, so if someone's taking a selfie, they're taking a picture of themselves from outside the body looking at them. So that is the same as when you're kind of before you're taking a penalty, before you, I don't know, sprint start, before you start in a swimming race, whatever. Okay, in that situation, you get from outside, you take a picture, and you picture yourself doing that skill successfully. Whereas you think of mental rehearsal maybe from within, looking out from your eyes, like kind of what you're going to do. And that's a slight difference there. Goal setting then, used this before, could be a really good way to prevent cognitive stress. So, you know, setting achievement of smart targets can really help confidence. Finally then, mindfulness. So mindfulness is this concept of kind of trying to avoid what could be really, I suppose, apparent whenever you're in a situation, is you start thinking about things in the past. Okay, so you might think of a mistake you made earlier in a game. You might start to think about how this could affect the future, the end result of the game. Mindfulness is the process of paying attention to the present moment. Okay, and often people can do this by sometimes like meditation, so kind of just thinking, trying to stay in that moment, thinking about their performance at that time. Okay, so get the key definition down. If you want to add any examples, then you can. Now the final one, final group of stress management techniques are somatic. Now these are physiological stress management techniques. What are they? Well, the first one is something called progressive muscular relaxation. Now, progressive muscular relaxation is the kind of sequential contracting and relaxing of muscle groups. So basically, if you imagine, you grab your fist, you really clench it hard, okay, and then you slowly release that. And the idea is you go all the way down your body doing it. Imagine a kind of a golfer. They might really tense their arms, squeeze, and then just relax it, and that helps reduce the kind of muscle tension that you can have. The downside to that can take up to 45 minutes. We'll have a look at the evaluations in the lesson. Biofeedback then, this is basically the monitoring of physiological changes in your body to kind of help prevent stress. So what it will be, it could be a variety of different equipment that measures these changes. It could be heart rate monitors, blood pressure monitors, all these things that kind of wired up and just show you when you're starting to show the symptoms of stress. As I'm sure you can work out, breathing rate, heart rate, blood pressure increases. Centering them is a key strategy for somatic stress. And basically, this is kind of thing. Say, for example, you are darts. I mean, obviously, I don't tell you not to use really darts, but rifle shooting, archery, anything like that. So basically, you're in that situation and you're getting a lot of kind of physical stress symptoms in your hand and your arm. And what this is kind of trying to diverted your kind of stress centrally to your navel, your belly button area, in your centre of your body, and you concentrate in there and just reduce putting your stress into the middle. So in that point, it's not kind of really kind of, I don't know, really focus specifically on a certain limb or body part. It's right in the middle of your body, so it can radiate around that. Finally then, breathing control. I think people will kind of all have experienced this. You get these kind of physiological symptoms and then suddenly deep breaths. Okay, these deep breaths, if you take that deep breath, can help prevent muscle tension by getting the oxygen into those muscles, allow them to respire effectively. So that's the kind of screencast over. Your job is to make sure you've split your Cornell notes up into your three components. You've got stress definition, stress causes. Then we're looking at cognitive stress management techniques, and then somatic stress management techniques. It's really good to have a think back to ASPE about when we've used these terms. We've talked about anxiety, very similar to stress. We've talked about that concept of cognitive and somatic, and we've also talked about some other things linked to this. So we can, well, I'll talk about those in the lesson. But if you can just make your notes on these, make sure you've got a good set of notes on them. Last topic, lots of potential for synoptic links in this lesson. Okay, thank you.